How to treat cough. Medication. Treat suspected underlying cause of cough. Allergic rhinitis. Antihistamine. Nasal corticosteroid, e.g. Flonase. Singulair. Post-bronchitic cough greater than 3 weeks. Ipratropium bromide inhaler. Inhaled corticosteroid. Prednisone for 5-day course severe cough. Acute bronchitis with bronchospasm. Albuterol metered dose inhaler. Advair not typically covered or recommended. Asthma exacerbation. Albuterol metered dose inhaler. Inhaled corticosteroid. Prednisone for 5-day course severe exacerbation. Upper respiratory infection with postnasal drainage. Nasal saline. Guaifenesin, e.g. Mucinex. Nonsteroidal anti-inflammatory drugs may reduce upper airway inflammation. Combination antihistamine decongestant. Antihistamine may reduce nighttime postnasal drainage but may predispose to sinusitis. Gastroesophageal reflux disease. Antacid medication, e.g. proton pump inhibitor. Paroxysmal cough without RAD exacerbation. Consider pertussis whooping cough. Nebulized lidocaine. Thanks for watching. Please subscribe to my channel. Have a good one.